welcome in to be our guest and to your health. And our community, like you were saying,
Yes.
Jack, it's very important to know in the health system what actually is available to us. And we have with us today Peter Selman, who is the CEO of Baptist South and used to be the CEO at Baptist East.
That's right.
And so you really have kind of covered a lot of ground. And let's talk today about the Baptist health system and the opportunities for health care that affords, because they are so myriad.
Absolutely. Well, for those of us who live here in the River region, we're actually very, very blessed to have the comprehensive array of healthcare services that we have here. And I think it's incumbent upon us, when our mission statement says that we're here to serve the needs of the community, we have a growing community. And as people go to the polls today to vote for a mayor and city councilman and so forth, we're very fortunate to have the city and county leadership that we have that's grown our community, and it's our responsibility to grow right along with that. And so Baptist Health takes that commitment very seriously. We're the largest healthcare system by far in the River region, with 3 acute care hospitals, Baptist East on the east side of town, Baptist South more centrally located in our Prattville Baptist Hospital that serves sort of the Autauga-Elmore County region. But our system is so much more than just those hospitals. We acquired Montgomery Cancer Center on Carmichael Road 3 years ago, and so we're very into cancer and oncology services now, and that's a very, very important component of what we have. We have Montgomery Surgery Center, which is an outpatient surgery center located on the Baptist Medical Center East Campus on Taylor Road. We have a series of imaging centers where you can go in and get your x-ray, CT scan, MRI, conveniently located really throughout the River region, multiple locations there. And through our partnership with American Family Care, our Pri-Med brand, which is the urgent care centers that are, there's 5 located in the River region, 5 Pri-Med locations. When we merged with American Family Care in their 3 locations, we now have a total of 8. So there's 1 in your neighborhood conveniently located. So it's important to us to have those multiple geographic access points so that people can access the Baptist health system in whatever setting is that they need.
What I really like, though, is the fact that you look at wellness also.
That's right.
Because obviously, top of the mind, you say Baptist Hospital, but that's the reason we wanted to move into Baptist Health, because you're concerned about the whole health aspect. In other words, if our viewers, as they go there, if you have diabetes, you're going to help them with the treatment of that diabetes. It never goes away, but you're going to help them keep it under control.
That's right.
Nutrition, you have a wonderful nutrition department.
We do. And it's interesting to look at healthcare at sort of a macro, zoomed out view. Really, it's a transformation of healthcare throughout our country, of moving away from that episodic treatment of care in an acute care hospital setting to changing incentives the way they should be, in my opinion, to keep people healthy and really out of the hospital.
Amen.
Our business model needs to change, but in our country, which is not that unlike most other countries, but certainly in Alabama, it's sort of the old 80-20 rule. We got about 20% of the population that consumes 80% of the healthcare resources, and those are those chronic illness, the diabetics, COPD, congestive heart failure, coronary artery disease patients that most of them can be managed in an outpatient setting outside the hospital, and that's the way we'd like to do it. But I tell you, the other major, I would say, crisis that we have in our state is mental health.
I agree.
About 1 in 4 citizens suffer from some mental health ailment, and we are that is a very, very underserved population. Now, Baptist Health has the only inpatient freestanding psychiatric facility in the community at Crossbridge, which is actually a department of Baptist Medical Center South.
It's on Narrow Lane Road?
Yes, sir, it is. It's a 60-bed behavioral health facility. It's a short-term inpatient stay, so the average length of stay for our patients is about 5 to 7 days at that location.
The other thing I'd like to do for our viewers is you people have been strong supporters of medical outreach ministries,
Yes.
which I've been affiliated with for God knows how long. But when you talked about people that are underserved,
Yes.
if we have any problems with Medicaid, they take care of people that have no Medicaid, and they can get to them so they don't wind up in the emergency room. And that's, thank you for that.
And ministry is really the operative word. I
Yes.
mean, that is a special calling for
It
the
is.
people that work in that location, that a lot of them donating their time, energy, and efforts to that. It's located right here on Southern Boulevard.
Premier doctors, they
Yes,
may
absolutely.
have, we have Dr. Cyrus, who
Yes.
used to do open heart surgery.
That's
now
right.
he's treating the common cold and loving it.
How about that?
Isn't that amazing?
How about that? Keeps
Yes.
them going every morning.
Absolutely, it sure does.
Well, Peter, thank you so much for
thanks for
being
having me. I
with us.
appreciate it
very much.
And I remember, I will always remember what we emphasized when you were with me as my CEO, and that is two things: the competency and the compassion.
That's right.
And I applaud you for that, because Baptist is a ministry.
Yes.
And I love the fact that you're under the umbrella of UAB.
That's right.
Because there's nothing better. We're fortunate in this state to have you.
That's a great partnership with us in terms of access to resources that we might not otherwise have. So.
Well, thank you for being with us, and we'll be right back.